Okay, everybody, it's 4 o'clock, so I'm gonna get started. I have 25 slides in only 30 minutes, so I'm gonna be pretty quick. I'm gonna turn on comments on the stage. So I believe if you guys ask me a question, I'll actually be able to see it on my view. Um, I'll try to get through those. So definitely send those to me. If we don't get enough time, I will like maybe just I'll ask you for your email and I can just individually message you back. Or if you have our functional portal, you can also message me through there through the Servo portal on any specific peptides. I tried to not get too detailed on everything, but we'll see how it goes. Here we go. Okay, so welcome to the world of peptides. For those of you who don't know me, I'm Betsey Nettemeyer. I'm a functional provider. I did primary care for the past 9 years before this in a very traditional setting, and now I'm purely functional and integrative medicine. Um, I try to marry the two together, but I definitely take more of a natural approach to things. I do these webinars once a month, and this is going to be all about peptides. I personally use peptides. They've changed my life. They've helped me heal in more than one way. So I'm excited about this webinar for you guys. Okay, so what is a peptide? First things first. So peptides are amino acids, and they're very short chains of amino acids. So when you think of like the building blocks of life, an amino acid is what creates the building blocks of life for every cell and everything. Um, Long chains of amino acids are proteins. So these are smaller than a protein. These are tiny little peptides. And so they're short chains. They typically are just 20 to 50 amino acids. Because they're so small, they're usually the best absorbed. They usually act on different pathways and different cascades of things. There's kind of a peptide for everything, as you'll find out, but they're absorbed really great and they do a lot of fun things. So they're biological messengers. They tell your cells to perform specific actions. And we'll go through each of those things. So first things first, hopefully I don't even take 60 seconds here, but weight loss. So GLP-1s are peptides. GLP-1s is just basically an umbrella term. Semaglutides under there, tirzepatides under there, retatrutides under there, a bunch of different GLP-1s fall under the GLP-1 pathway, but the ones we think of the most are semaglutide and tirzepatide. What they do is they control appetite, insulin, and inflammation. They are very helpful. They're very magical. They're very revolutionary, but they go way beyond weight loss as far as like what they do for your inflammation. So, for example, we have patients who have autoimmune diseases like lupus and rheumatoid arthritis and ulcerative colitis who aren't trying to lose weight, but they want to control that inflammation. And GLP-1s have really helped them basically be allowed to do that. I put the prices, the best of my ability, on the bottom of each slide. I'm not going to go through them specifically, but that is our prices for GLP-1. So you can see 5 units of semaglutide is $12.50. That's your responsibility a week. If you did 5 units of tirzepatide, it'd be $16.25. And if you purchased a vial, that's what the cost would be for 2 mLs. 2 mLs at 5 units would last you 40 weeks. So it kind of gives you an idea of what that cost breakdown was. Okay, I also have notes just in case I need them. BPC 157. So this is the body's protection compound. This really helps with gut lining repair and anti-inflammatory. You can get this in an oral option. You can also get this in an injectable option. If you're doing injections, it's going to be more for like tissue repair, bone, muscle, joint recovery. If you do oral, it'll still help with those things, but because it goes through the gut, it's also going to help with the gut lining, like leaky gut, irritable bowel, ulcers, injuries. I personally pair this with KPV, which we'll get to. And then there's a couple that thymosin beta 4 and PRP, because there's some other options that you can do with it. But just kind of weigh the pros and cons about whether it's oral or injectable you want to do. And if you need help with that, I can certainly help you. But think gut and think bone, tissue, joint. Thymosin beta 4, so a TB4 is the other name for it. You might see around and about. This is like the repair captain. So it's going to help with angiogenesis and tissue regeneration. Angiogenesis is formation of new cells. Okay. Speeds up healing for injuries, helps with skin damage, post-op stuff. Often we use this in aesthetics. So you can actually use this as like a gel. So after you get microneedling done or after you get a laser treatment done, sometimes you can add exosomes like stem cells. Sometimes you can add PRP without growth factors in them, but you can also add thymosin beta-4, a peptide, just topically to the face that really helps with that recovery process. We do offer that here at TrueBody. If you're interested in that, obviously you need to let us know beforehand so we can order it in for you. KPV. So this is the one I pair with my BPC 157. So there's a supplement that I can order from a pharmacy for you that just has them both together. It's called Gut Tides because it helps a lot with the gut. But so silent inflammation's worst enemy would be KPV. So it's a potent anti-inflammatory. It's a tripeptide, so 3 peptides in one. It's incredible for the gut, skin, eczema, acne, and autoimmune flare-ups. We obviously pair this with BPC 157 with gut healing. It's kind of a stack that we like to do here at TrueBody. Yeah, I really like KPV. It's great. It's kind of my go-to for really tough, like autoimmune clients and tough GI cases. I'm actually just messaging somebody in the portal, and I'm going to see if this is something she wants to try. Okay, so we talked about thymosin beta-4, and now you have thymosin alpha-1. So very different. This is the immune whisperer. I named all these, so I hope you love them. So this activates T cells, modulates overactive immune system. T cells are what fights off infection. So think immune. I want to be healthy. I don't want to be sick. I don't want to get cancer. I want to be able to fight off whatever comes my way. So it's powerful for post-viral syndrome, so long COVID, post-COVID, Lyme's disease, EBV, long COVID, I already mentioned that. Also useful in autoimmune and immune-compromised patients. So these are for the people who feel like they're always sick, people who work in daycares, schools, providers, people who run sick people commonly, or just feel like their immune system is just never quite robust enough. This one's a great one. It comes in a nasal spray, which is pretty convenient, or an injection. Most people forego the needles if they can help it. I really like this one for Hashimoto's, mold illnesses, and then chronic infections. So that one's cool. I'm going really fast, guys, so put stuff in the chat. I think I'm doing good, though. Well, yeah, I think I'm a minute ahead. Okay, so IGF-1. So this is not a peptide. I wanted to talk about IGF-1 because the next couple relate to IGF-1. So IGF-1 stands for insulin growth like factor 1. It's a hormone made by your liver in response to growth hormone. It drives many of the body's growth, repair, and recovery processes. So what does it do? Stimulate cell regeneration in the bone, the muscles, joints, skin, organs, boosts collagen production and wound healing, supports fat metabolism, glucose regulation, and improves muscle mass, recovery, and skin quality. So this is a great thing to have, right? The younger we are, we have a lot of this. The older we get, we make less of it. So when it's low, you can have, you start to get fatigued, you have poor recovery, you get loss of muscle tone. The older we get, it's just so hard to build that muscle. You get skin thinning and wrinkles. Again, aging, here we come. IGF-1, here's our problem. Poor libido, poor sleep, low libido, and metabolic slowdown. So these next peptides kind of work off this. So this is, I want to make sure biggest peptides that work with this: CJC 1295, ipamorelin, samorelin, tesamorelin. Yeah. Okay. So here we go. I think that was pretty much, anyways. So GHK CU or GHK copper, the beauty brain peptide. So this is a copper peptide that really helps with collagen support. It can also be used with hair restoration. So if people are worried about hair thinning and you're doing like microneedling, PRP treatments to help with stimulation of hair follicle and growth, this is a great one that you could do topically, like in a cream form. It can also help like anti-aging. It's kind of like a serum. If you think of like hyaluronic acid. Like this is just a peptide. It's just a different peptide form that kind of does similar things. It's a little bit more robust because of how small the molecule is. And it also supports DNA repair and wound healing as well. Okay, so this is where we start to affect our IGF-1. So growth hormone secretagogues. So you've got sermorelin, ipamorelin, and tesamorelin. And those are listed in order of like potency. So sermorelin would be like your freshman team, ipamorelin would be JV, and tesamorelin would be like varsity. So they're priced kind of based off of that. They have different options as far as like sermorelin does have an oral form, but most of the time they're all injectable. Some of them you can get in troches and some of them you can get in nasal sprays. But basically what they do is they all stimulate natural growth hormone release. And growth hormone is what's going to act on IGF-1 levels. And so you're going to get all the benefits of IGF-1 levels being high as far as like basically reducing aging and all those different subsets that I listed, just to remind you. Basically fatigue, recovery, muscle, skin thinning, wrinkles, poor sleep, libido, and metabolic slowdown. So it's all going to be working on those things. Just think, depending on which one you do, it's going to be more potent. It's going to have more robust effects. So sermorelin is not going to probably make you sleep as effectively as tesamorelin would help you sleep, or sermorelin is going to help you build muscle, but maybe not as drastically as tesamorelin would. So just kind of think of it that way. People who have really bad insomnia, this is obviously super helpful to implement just for like the sleep part of things. But people who take this typically feel like, man, I usually work out one time a day, but now I can work out like 5 times a day because I've just recovered. Like I'm not even sore anymore. I'm way more productive like in the gym. Also developing lean muscle, that's very tricky for a lot of people. So that's really helpful. Losing weight's a lot of people like that's kind of their go-to, right? Want to lose weight and skin quality. Like everybody, yeah, wants that because it's working on those IGF-1 levels. Okay, CJC 1295, the long-lasting growth hormone booster. So growth hormone is going to act on IGF-1. So this is just another peptide that is in that cascade. This is also going to help with poor sleep, slow recovery. This is going to help a little bit with some hormones. So going to help some perimenopausal, menopausal vitality. So just kind of getting through that stage season of life. It's going to help support lean muscle and exogenous growth hormone, anti-aging skin, and cognitive support. A lot of times, and honestly, if I'm going to prescribe you like tesamorelin, I'm just going to pair it with CJC. Ipamorelin. Usually those two are paired the best together. And that way you're going to get like 2 different peptides that all work on IGF-1, but in a different part of the cascade to help with all those different things. So, I made some notes here. So I use CJC with clients who need help rebuilding from the inside out. So, I had someone even ask me today if there's any that like really help with hormones. They're not going to be like, oh, I'm going to stimulate more estrogen or more testosterone, but they would potentially help you go back to your original hormone rhythm of things. So kind of in a roundabout way. Yeah. PT141, the libido desire peptide. This one's fun. I like this one a lot. It's kind of interesting. So it can really help with hypoactive sexual desire, specifically in women. I feel like we have a lot of things that guys can have as far as like Viagra and Cialis and those kinds of things. And women can have those things too, but we don't have anything like specific for us. PT141 is a peptide that can help with that. So you can do an injection, you can do a nasal spray, you can do a troche, you can do a lot of different things. The reason why it's a little bit different than Viagra is that it works on the brain. It doesn't work on the body. So like your Cialis and Viagra, those are going to cause vasodilation. So lots of blood to like the scrotum or clitoris or whatever. Whereas PT141 it's really going to affect your desire in your head. So that's honestly a little bit more romantic than just like a physical change to your body, but there's a time and place for both and they're commonly used together. Can be used in men, but usually not. There's just more options for them. So erectile dysfunction, low libido, arousal due to menopause, stress, or hormonal imbalance. It does work super well with testosterone and oxytocin, which is interesting. I do have a slide on oxytocin. It's the love hormone, right? And so, yeah, the other thing about PT141, it also works on melanocytes, so it can make you kind of tan looking while you're on it. It's interesting. So it can give you kind of like this natural glow without necessarily being in the sun. Okay, so some non-peptide pluses. So we've got methylene blue. So methylene blue is not a peptide, but gosh, it is a powerhouse. So methylene blue is what's going to like help boost brain, help with focus. So a lot of times when patients have a history of being on a stimulant for like ADHD or focus, a lot of times they're looking for an alternative to that. Methylene blue would be a great alternative because it really helps with like focus and like brain boosting. It also helps with mitochondria support, mitochondria supporting blue dye. So mitochondria is the powerhouse of every cell. It's what basically tells the cell what its job is. It gives it energy. It converts things into energy. All those different things come from the mitochondria, and it works directly on the mitochondria. By working on the mitochondria, like I said, it enhances ATP production, which is energy. That's a molecule for energy. Helps with memory, resilience to oxidative stress. Oxidative stress, what makes us old, what's increasing our risk of cancer, all the things we don't love. Oxidative stress, if we can get rid of it, that'd be great. So this can help basically block that oxidative stress. It is commonly used in combination with NAD plus or some other peptides for performance. I personally use it with NAD. So NAD is not a peptide. It's different. But they work together. They both work on the mitochondria of the cell. NAD is also going to help support mitochondria. Methylene blue can help repair mitochondria. So they work similarly. You can use them together or separate. It's kind of up to you. Cost sometimes makes you want to do one thing or another, but methylene blue, I think, is amazing. There are forms of methylene blue that you shouldn't take. So it is best if you get this through a pharmacy and not online or like through Amazon, just FYI. Oxytocin, so the connection and confidence molecule. So I call it the love hormone. It's for social anxiety or stress, super helpful, very calming, very just kind of like, oh, everything's good. It also can enhance orgasm and emotional closeness. It supporting trauma recovery and self-esteem. And it's commonly paired with PT141 or hormone therapy. So a lot of times when we're going through menopause, perimenopause, even if we're a guy going through andropause, and we're not really having those connections that we used to have or we used to remember, a lot of times we're looking for like the PT141s. And when you can actually get a troche that pairs PT141 and oxytocin together and tadalafil together, which is Cialis. So there's a lot of ways you can kind of use this. You can also just use it by itself. There's a nasal spray of oxytocin that you can just do, and you can do it a couple times a day before meals, before bed, can help you sleep, those kinds of things. But sometimes it's called the cuddle hormone. So oxytocin boosts connection with others and with yourself. So if you just need a little boost, a little bit of self-love, this is a really good one for you. I would prefer this over an antidepressant for sure. Let's see here. That's kind of all I had on that. Okay, so next gen peptides to watch for. So some of these are available off and on. The FDA commonly just changes the ability for us to prescribe certain things, and so yeah. I'll kind of get to that here in a second. So MOTS-c is the mitochondrial metabolic activator. So it's going to activate AMPK. So which that basically is a molecule that supports like fat loss and burning and glucose metabolism. It's going to help improve exercise capacity and energy. And it can also support insulin sensitivity and reduce inflammation. Currently, this one is pulled from the market. It was recently available, so I left it on here just so you know what it's about, because they're commonly going off and on based on what they'll make Class C or not Class C, so prescribable or not prescribable. So currently unavailable, but this is a really great one to pair with like GLP-1s or do in place of GLP-1s. So something to just watch for. Okay, 5-amino 1-MQ. So this is the NAD plus protector plus fat loss helper. Okay. Um, Oh man, so 5-amino 1, I basically pair this with NAD. So when your body stops making NAD and you start having more and more fatigue and you start gaining weight, basically this 5-amino 1 is basically what that responsibility is from. And so if you can replenish this molecule, then it can help you lose weight and fat, and help support muscle preservation. So this is commonly paired with everything else, but can be used by itself. This is a molecule that we just need in abundance, that we slowly lose as we age. And NAD is also one of those same molecules that we have a lot when we're younger, and then slowly we lose as we age. And so it's going to help protect NAD, and it's basically going to help keep those molecules around longer. So it's really helper. It's really a good help for people who are trying to lose weight, and you can pair it with the GLP-1s or do it by itself. There's even some other things that are more helpful than GLP-1s, which we're going to get to. Can be more helpful than GLP-1s. Okay, AOD 9604. So this is the fat burning fragment of human growth hormone, so HGH. So this is going to target stubborn fat deposits. It does not increase IGF-1. So IGF-1 was more of the CJC 1295 and the growth hormone secretagogues like sermorelin, tesamorelin, and ipamorelin. So AOD is not going to work on those. I didn't really go into this, but IGF-1 obviously can help with cell turnover and angiogenesis, so creation of new cells. So when that's in abundance, there are some things that we need to be aware of that we don't want. Like if someone had cancer, for example, we won't want to put them on something that's going to increase their IGF-1 because it would make those cells turn over really fast. And if those cells are turning over really fast, we're basically creating a cancer that's out of control, right? So obviously you want to do these under the supervision of a provider, and you want to make sure your levels and everything look okay. You also want to dose it right and make sure the frequency of it is appropriate. So you're not taking it continuously for a certain amount of time. You're taking breaks from it, which I can walk you through what that looks like. So for example, if someone has cancer or is worried about cancer or whatever the case is, and they're like, I don't want to take anything that's potentially going to increase my IGF-1 levels, this is a great alternative. So this is going to help stimulate similar things that, it's not going to help with sleep as much and things like that, but similar things to the human growth or the growth hormone secretagogues, but it's just not going to target the IGF-1. So take it or leave it. It's a great one. Honestly, you can use it alongside the semaglutide tirzepatide family. You can use it by itself because it's going to help you lose fat and reduce your blood sugar, things like that, but not target IGF-1 levels. Tesofenacine. This is also, this is the one I was kind of alluding to that might be a little bit better than the GLP-1s. So tesofenacine is neural plus appetite control. So it also, just like the GLP-1s, can suppress appetite via dopamine and serotonin and norepinephrine, but it also can improve focus and mood, which GLP-1s do not do anything with that. In fact, they may make that worse, to be completely honest with you. And there is some research out there that's showing that tesofenacine can have some faster weight loss than the GLP-1s, which is pretty nuts. GLP-1s are still by far very revolutionary. They have a lot of other benefits to them, but that the studies that are coming out on tesofenacine are pretty stinking good. So something to keep on the back of your minds. Okay, so some real life protocols at TrueBody. So for gut reset, these are just common ones and cost effective ones. So gut reset, BPC 157 paired with KPV. Post COVID, working on immune, things like that. I do thymosin alpha 1 with NAD and GHK copper. For hair, skin, you can do topical GHK copper with microneedling lasers and thymosin beta 4. And just for like a performance stack, like I'm purely wanting to build muscle and just get toned, lose weight, those kinds of things, I would do ipamorelin plus methylene blue and some creatine. Now, you kind of went through those peptides. I went through those really fast, but there's those peptides and there's other things that would probably improve these stacks, right? But cost-wise, and just really, like, you could do every peptide, but it would be really expensive, so you'd still just kinda wanna, like, narrow it down to, like, what do you really need? And I can help you with that if you're not sure. Um, so yeah, there's that. Okay, so why peptide source matters. Okay, this is a common question I get because people are like, well, I saw this on Amazon, or I went to like peptides.com or whatever the case is and just ordered them on by myself. So all of our peptides are sourced from a licensed US-based compounding pharmacy. All of them, no matter what. So these facilities follow strict quality and sterility standards. So each prescription is tailored specifically to you and does require provider oversight. It's going to affect you, just like I was talking about the IGF-1 levels. Like, if you're not taking these medications or these peptides appropriately, they can cause some bad things to happen. They're not just like, just because they're a peptide, that means they're safe kind of thing. Anybody can claim to be a compounding pharmacy. Anyone can make these molecules and these medications. It doesn't mean they're making them the right way. That doesn't mean they're making them the cleanest way or the most potent way or the safest way. So just some things to think about. Be very cautious of online peptides or research-only sites. So there's no medical supervision or dosing guidance, meaning like they're just like, here's your vial, bye. Or you don't have to go through a provider to get it. Be very cautious. Most of those online companies that you don't need a provider through, they're not going to just come out and say this, and you're probably not going to be able to find it on their website, but most of them are manufactured overseas. So just something to think about. There's zero regulation overseas, which can increase your risk of contaminants, heavy metals, incorrect dosing, inactive peptides, adulterated ingredients or filters. So the bottom line, if you're buying peptides without a prescription, you might be injecting just junk and potentially harming your body instead of healing it. That's my soapbox. Peptides are also only one tool. So these are just adjuncts and they're not replacements. You need to have good foundations. You need to talk about your hormones with your provider. You need to go through these peptides and really decide which ones would be right for you, paired with other things, trying to get the root cause of stuff. You need some good foundations, also lifestyle wise, like sleep and nutrition, gut health, all that. So yeah, peptides, precision and personalization. Okay, so I got 3 minutes, you guys. Okay, obviously questions, put them in there. I see one. If you are interested, you can get 15% off any peptide protocol booked within the next 24 hours. The drugs themselves you will get at cost. So I'll pull them up from the pharmacy and you just pay exactly what they are. I can't discount them if that's like the drug, but you will get provider cost. So I won't basically, if I charge the clinic card, you'll get clinic pricing. But if we charge a personal card, a patient card, you'll get like 3 times the price, which I know that's ridiculous. That's why I don't honor that. We'll pay for them at cost and you'll just be charged that. But if you want to get some money back, like for example, if you want to do the growth hormone secretagogues, I would want to run like an IGF-1 on you just to know where your baseline is. So we know if that's increasing over the course of a couple of months. So like any labs that you would need, you'd get 15% off. If you needed to review those with me, you'd get 15% off, like that whole thing. If you're interested in this, just text or call our phone number. Leanne will help you out, 307-243-3554. Okay, so I really need to avoid losing muscle. Is it smart, safe to do the performance stack with tirzepatide? Absolutely. Yes, it is. Absolutely. A lot of the peptides are paired together. And that's very commonly paired together. So 100%. And if you want to message me in Serbo, we can get everything priced out for you and ordered. So I would love to do that. And I think that's very smart. Absolutely. Any other questions? I think that's my last slide. Yeah, that's my last slide. I went through that so fast, you guys. I have 1 minute left. You're so welcome. You're so welcome, sweets. Anything else, you guys? This was a lot of fun. I know I went through that fast. I was thinking what I would do is I'd probably send out like a cheat sheet. If you're interested in a cheat sheet that kind of lists all the peptides and kind of what they're for and everything, please send Leanne a message. Just text the number and say that you're interested in the cheat sheet, and we'll just get that emailed to you. And that way you have a list of them, and I'll try to put prices in there. I'll try to put dosing in there, things like that, things that you'd want to know. So yeah. Okay, guys, that's my 30 minutes. I appreciate you all. And till next time, see you later. You're so welcome.